Hi, I'm Oliver Van Oekelen. I'm a clinical fellow at Mount Sinai in New York, and very excited to be here at IMS and present our work on S100A8A9 mediated resistance to bispecific antibody therapy in multiple myeloma. We had an abstract here looking at S100, which is a damage-associated molecular pattern molecule. So it's a part of the immune system that's being released by myeloid cells in the microenvironment. And that's triggering expansion of immunosuppressive cells, regulatory T cells, and myeloid-derived suppressor cells. And we know these cells sort of help dampen or suppress the immune responses, including responses to T cell engaging therapies like CAR T and bispecific antibodies, which we know have great efficacy in myeloma, but unfortunately, we see that some patients do relapse. And for us, it was an important question to better understand why patients relapse and then perhaps come up with treatments to reverse that. And so in order to look at S100, which is one of the factors that we think is involved in this resistance to bispecific antibodies and or CAR T, we looked at a group of patients that were treated with bispecifics, both GPRC5D or BCMA bispecifics, and we actually saw that patients that had shorter progression-free survival, so that relapsed earlier, had higher levels of S100 even before they started therapy, and then when we checked longitudinally during treatment, we saw that they maintained these higher levels, and there was a really strong correlation, and so this is really what prompted us to do more mechanistic studies to understand what is the mechanism and can we reverse it. And very excitingly, we were able to show with in vitro studies that if you expose T cells, so immune cells of patients or healthy controls, to S100 in a Petri dish, they're actually not as good at killing myeloma cells. And we see that they're not as good in producing cytokines, and they actually get this more exhausted phenotype. And so this correlates very nicely with what we saw in patients as well. Very excitingly, we're collaborating with Albert Einstein, who are developing a monoclonal antibody that can really target S100. And we've also shown in our abstract here that if you do that, you can reverse some of these effects and really restore the killing efficacy of the immune system in targeting myeloma cells with bispecific antibodies. And so it really has, I guess, two main takeaways. One is we're further looking into whether we can study S100A8A9 as a potential biomarker to identify patients that might not do as well with some of the immune therapies that we have, so that we perhaps can, modulate their treatment. And the other part of it is, once we really have the mechanism understood, can we target it and reverse it and perhaps, extend the efficacy of bispecific antibodies in those patients that need it.